the challenges facing the world. Most especially, we can't take away the health sector. We can't take away what the World Health Assembly brings on board in terms of trying to ameliorate the plight that the world people are faced with when it comes to health issues. And what is the relevance of the World Health Assembly at the policy initiatives they come up with? And of course, what are the implications of these policy initiatives to humanity? And that's what we're about today. And I will be joined by a physician and wellness entrepreneur from Lagos, Dr. Obielomani Ide. Good morning, Ide.
Good morning.
All right, good to have you join us today. We are having a very important topic here on the World Health Assembly, reviewing the health policy initiatives and the implications. And most especially when we know the comparative advantages that the World Health Assembly comes with as against its non-existence. But we know that it comes with a whole lot of benefit. But can you just, let's have a clearer picture of your perception on the policy initiatives and how well they've rounded the health of the people of the world?
Well, the World Health Assembly has been able to shape, since its inception in the 1940s, some general guidelines about how infectious agents and outbreaks in different countries will affect trade and travel, the movement of persons and goods and services. That has been its achievement. However, the very framework of how the World Health Assembly is constituted and how it amends its own bylaws and constitutions lend itself to undemocratic practices. And we started seeing those after the COVID pandemic. We were boxed into a corner last year, September, such that we now have less time to understand the changes that are going on in the World Health Assembly and be able to respond to them. There have been timeline changes and amendments. And one has to question why a body that is supposed to be dealing with the good of the entire global population will be reducing the amount of time that populations have to understand changes within the body and be able to respond. And the fact that only the president of a country can say yes or no to an amendment also lends itself to an undemocratic position. Nonetheless, while we have all these reservations, the current situation at the World Health Assembly does give us some guarded optimism. There are two legal instruments that were on the table for votes this 77th World Health Assembly, which started yesterday. And thankfully, the pandemic treaty, which was basically a document that sought to have pathogens be bandied and traded, information about pathogens of potential pandemic potential. There was a trade basically was going to be set up in which those who will find them will be remunerated by those who will develop the vaccines. And thankfully, global pushback has allowed for that pandemic treaty to not be voted on. There was no agreement by the member states. We unfortunately still have the equally problematic amendment to the International Health Regulations still being considered for voting, and it is to the detriment of our nation if we participate in this voting.
Okay, Dr. Ide, you basically spoke about the challenges, and I believe the World Health Assembly is an arm of the World Health Organization. I stand to be corrected anyways. But let's look at what you've said so far, and let's look at the future. You spoke about the pandemic, how it attended to the issues, and of course the setback or drawback that we had, if I got you rightly. But do you see that the future is bleak or bright?
Well, the future is bright because the censorship of true scientists that took place during the time of COVID has been brought to light very, very clearly. We have clear demarcations between those who are true scientists and those who peddled misinformation and disinformation, as well as malinformation during the COVID pandemic. We know those who were complicit in forcing mandate policies and mandates that we knew before the pandemic were detrimental to health. Lockdowns, masks, even the rollout of the COVID vaccine. We knew that the rollout of the vaccine in the middle of the pandemic was a bad thing to do. So thankfully, we have very clear information as to those whose information we can trust, those in the scientific and policy communities that we can trust, and those that we can't. And so in that, guys, yes, we do have a lot more optimism in the public health space globally. Unfortunately, we also still have this dark side that is trying to undo the democratic rules and regulations that we have so far enjoyed in the last almost 60 years, 80 years of the World Health Organization's existence, and pushback on those moves and those attempts is growing, and we are hopeful that we will be successful to keep global public health working for the good of the global population, including our nation, and protecting our national sovereignty, even as we continue to be members of the global community.
Question, because we keep hearing rumors from the grapevine over more outbreaks that are coming. And of course, you may mention of the vaccines that were rolled out midway while there were lockdowns that never really helped, because the lockdowns, brought about a whole lot in terms of the economic downturn. Now, do you see the functionality of the World Health Assembly in tackling future outbreaks? And what's the role of the governments of the world in helping to solve issues that may emanate as exigencies?
Well, unfortunately, at the level of the World Health Assembly, one has to come face to face with the reality that whoever pays the piper dictates the tune. And the World Health Assembly is made up of delegates of member states. We understand that. However, the WHO is an organization with very strong, very well-funded departments that are beholden to its donors. And its donors, unfortunately, I will have to let you know, are not the member states. It is corporations, foundations that fund a large part of the WHO's budget. And so the narrative, the plans, the agendas of these foundations are what actually the WHO sets in motion. And thus, at the level of the World Health Assembly, you have almost a fait accompli. If the global population, through its representatives had not pushed back on this pandemic treaty, we would be having a vote right now because the WHO had decided that it was not going to follow its own rules and submit a final draft of the pandemic treaty 4 months ago. And so, where you have possibilities for good, you also equally have possibilities for harm. And the funding of the WHO is a significant reason why there is a global call for by people in different nations to exit the WHO, because by its own activities, by its own actions, decisions, recommendations, starting from the pandemic in COVID-19, one can see that its goals and its focus has shifted, and it is no longer the actual health of the global population that is its primary desire. It might continue to say these things, but one has to look at its actions to be able to determine whether those words are true.
Goals have shifted, and do you seem to suggest that that could go a long way to also cause a setback in the health of the world's population?
Well, if you just take how the WHO handled COVID-19, it will be clear to you that you do not want the WHO to have an advisory role in the next pandemic that they have already explained to us is sure to happen. How exactly is it that the WHO knows that another pandemic is going to happen? Well, it will be able to know that for certain because it knew that COVID-19 started in China as a lab leak, even though they peddled the information that the Chinese government told them that it started in some bat markets. It's taken us 4 years to be able to come up with this, but we cannot trust the recommendations that come from the WHO. They told us, peddling what the Chinese government told them, which is, and China is a big funder, donor to the WHO, that there was no human-to-human transmission, and we didn't need to worry at the start of COVID-19. They went ahead with lockdowns and masks, recommending that those were measures that would reduce transmission, when their own experts in 2019 had already determined it was locked, sealed, and delivered that lockdowns had no place in the management of pandemics. And they still went ahead to recommend it. And there were innumerable flip-flops by WHO representatives. And even the COVID vaccine that has now come out, and many vaccine injured, and many freedom of information requests are showing just how the supposedly safe and effective vaccine was not tested for its ability to stop transmission. Now you have the World Health Assembly wanting to give, amongst other things, the powers to the Director General of the WHO to override what nations' health officials want to do in the case of outbreaks. How can you give power to an organization that has so clearly failed the world already in the first pandemic in such a long time?
At the beginning of this conversation, you spoke about that the future is bright. And after you've just spoken on the deficiencies we're having, and that even the World Health Assembly being politicized, what then can you say, or how can you draw a nexus of what you said earlier, that the future is bright, and what you just said now as a result of the delay we have in the management of the goals that is supposed to be, which is not being attended to? So, which means the future seems not to be bright.
I choose to be optimistic because if you were a critical thinker in 2020, you would realize that there was so much confusion, so much confusion. Who do we believe? What is true? What is real? And 4 years down the line, we have much clearer understanding of the public health landscape. We have we have warriors that have shown their courage in speaking out and letting the truth of what happened in COVID become known to the public. And so when I am speaking of when I'm speaking of brightness and light, it is relative to the darkness and confusion that was 2020. We have the WHO telling us that we should be ready for disease X. I'm sorry, it's because we have a director general that is not a doctor that you can have a pronouncement about a disease X that is unknown. No physician worth his salt will come and announce to the medical community that we should be preparing for disease X. It's all propaganda, but we have networked amongst ourselves, and we know the news outlets to trust. We know the scientists to trust. We know that we have broken through the lies and the propaganda that was, thrown at us in 2020, and so we are much better prepared for what the those who do not mean us well have planned in this unknown disease X that is supposedly coming. And it is because of that that our pushback is squarely facing now the amendments to the international health regulations, because the WHO does not deserve to have any more power given to it. Instead, we should not vote at the 77th World Health Assembly. That is our call. That is our stance. And it's a Pan-African stance. It's not just a stance by Nigerians here in this country.
Thank you, Dr. Ide. And as we wrap up, let's look at your final thoughts on this, most especially as you may mention of the fact that the donors who really bring food to the table or bring resources to the table for the World Health Organization are not really member states, are not members of the body, but foundations and what have you, and all that you said. So what do you think should be the way forward for members of the body to tackle this challenge you just enumerated? What are the ways that can be used to, change the narrative?
Well, the World Health Organization has gotten used to its fat budgets. And it has been, it is conquered by the monies that flow from these donors, chief of which is the Bill and Melinda Gates Foundation. You also have lots of bodies that have to do, aside from the Bill and Melinda Gates, other bodies that have to do with vaccines. The vaccine story is one that is one of the dark spots in the public health domain right now, because the principle of vaccination continues to be one of the successes of medical science. However, the chemical compounds that are an integral part of vaccines continue to harm millions of people globally. I believe that a very important way in which we can take control at the local level of what the WHO's focus is to hold on to our personal sovereignty is to advocate very vigorously for informed choice by parents when they are called to vaccinate their children, because a regular physician that does not go into the components of a vaccine does not know the harmful compounds that are there, and will be advocating for vaccines based on a historical perspective of vaccination, as opposed to
Thank you very much, Dr. Ide. A whole lot you
the
said there
chemical
as regards.
composition, specifically as a dose,
Okay, thank you. Thank you, Dr. Ide. A whole lot you've said. Big thanks
as
for taking out time to be part of this. You've done justice to it, most especially as you've revealed various challenges facing the World Health Assembly and how they can attend to the problems that come with it. And we just hope that the issue of the vaccine story, you just made mention of not having a background story of it, that every member state should dig into, making sure that we have a healthy, solution to the problems bedeviling the human race. Thank you, Dr. Ide Bielumani, a physician and wellness entrepreneur from Lagos.